So the other talk that I gave was on purely based on my research about looking at the cognitive outcomes in people with epilepsy with healthy cognition compared to people without epilepsy with healthy cognition. So, and then we also looked at the outcomes for mild cognitive impairment patients with epilepsy and without epilepsy. Mild cognitive impairment is when they don't have overt dementia, but they have some difficulty in memory and cognitive abilities. So when we investigated people with healthy cognition and those with epilepsy, active epilepsy actually. So active epilepsy meant that patients were having recurrent seizures compared to remote or resolved epilepsy who had a prior history of epilepsy but did not have recurrent seizures at the moment. Compared to no epilepsy, we found that people with recurrent seizures were a significantly high risk of cognitive decline compared to those with past history of epilepsy or those without epilepsy in cognitively healthy adults. So several years earlier, cognitive decline was seen in these patients. So we feel that seizures themselves and interictal epileptiform discharges may have a significant role to play in this cognitive decline in this patient population, again, highlighting the need for more aggressive management of epilepsy to get seizures under control in this patient population. Many times people will hesitate to proceed forward with surgery in the cases of poorly controlled epilepsy in older adults because surgery has its own comorbidities. But if it means getting their seizure under control sooner than later, I think we should not, if they're candidates for epilepsy surgery, we should not hesitate to move forward with epilepsy surgery because poorly controlled seizures and recurrent seizures can have their own impact, such as the impact on cognition.